Hi everyone, let's see this quiz on eyelids and orbit now. Okay, so I'm ready to give the test. So the first question is, I think, image question. Ptosis and Horner syndrome is due to which of the following? So this is an upper eyelid lateral view in which E is a levator palpebrae superioris, the belly of that muscle. C is a aponeurosis, means tendon of levator muscle. A is orbital septum coming from the periosteum to the tarsus. B is orbicularis oculi muscle. And the answer of this question is D. D is the upper tarsal muscle, that is known as Muller muscle, supplied by sympathetic pathway. And Horner syndrome is a problem in sympathetic pathway. So Horner's ptosis is due to D, upper tarsal muscle, that is Muller muscle. That's why the ptosis is very mild ptosis, because Muller muscle action is only 1 to 2 millimeters of upper eyelid elevation. And the surgery done is Fasanana servat operation, that is plication of the Muller muscle, known as Mullerectomy. That is a misnomer as well. So answer is D. Now extra fold of skin coming from lower eyelid. Coming from upper eyelid is epicanthus palpebralis, lower eyelid is epicanthus inversus. Uriblepharon and epiblepharon usually should not know at your level. Uriblepharon is increase in the lateral margin of the eyelid, and epiblepharon is actually the lateral margin is slightly straightened of the eyelid, causing a vertical orientation of the eyelashes. Now these two are generally not required. Epicanthus inversus is the answer, seen in blepharophimosis. Blepharophimosis means decrease in horizontal aperture. P. Ptosis. Epicanthus inversus. Telecanthus syndrome. BPES syndrome. What is telecanthus? Increase in the intercanthal distance due to soft tissues. Now, marginal reflected distance 1 is the distance of the upper eyelid margin from the corneal reflex. The corneal reflex is normally in the center of the cornea. In a 12 millimeter corneal diameter, the corneal reflex is in the center. Now, upper eyelid is covering 6 mm of cornea, means corneal reflex is not seen. That's why marginal reflex distance 1 will be 0 in this case. Marginal reflex distance 2 will be distance of corneal reflex from the lower eyelid margin, that is 6 millimeters in this case. How much is the ptosis in this case? Normally in 12 millimeters, 1/6 of the cornea, that is 2 millimeters, is normally covered, and upper eyelid is covering 6 mm, so ptosis will be 4 millimeters. So here answer is MRD1 is 0. Now inability of the eye to, this is eyeball, this is eyelid. When we look down, the eyelid follows the eyeball, because in down gaze, the levator palpebrae superioris muscle relaxes and follows the eyeball. In congenital simple ptosis, the LPS cannot contract, cannot relax because of LPS muscle maldevelopment. So the child looks down, it does not follow. That is lid lag sign. That is the answer over here. It can also be seen in thyroid eye disease, where it is known as one graphase lid lag sign. Inability of the eye to close in primary gaze is seen in cerebral palsy, that is lack of thalamus. Fifth palsy leads to decreased sensations of the cornea. Neurotrophic ulcer. Cerebral palsy leads to exposure keratitis due to lack of thalamus. And aponeurotic ptosis is most common cause of ptosis due to insertion of the LPS muscle problem, that is known as senile ptosis or traumatic ptosis. Most common cause of ptosis is aponeurotic. Now, patient of thyroid eye disease was evaluated for proptosis. I hope you know thyroid eye disease is the most common cause of unilateral, bilateral proptosis in ophthalmology. And normally in Indian population, from the orbit margins, the cornea is 16 to 20 millimeters in front of the orbit. So definition of proptosis is if the protrusion of the eyeball is more than equal to 21 millimeters, that is proptosis. So right eye was found to be 22 millimeters in front of the orbit margins. Which method cannot tell this? Now Navziger's is a qualitative method. You cannot tell it. You stand at the head end of the patient and look qualitatively which eye is bulging out. Hertel's scale McCoy are exophthalmometers. Means scale is also a normal measuring scale, which you can see how much is the quantification of proptosis. Napsicus cannot quantify. It is qualitative method. That is the answer here. The 5-year-old child with presenting with painful swelling of the eyelid following discharge from the right nose means there is sinusitis. All options have sinusitis. On examination, visual acuity was 618. No restriction of eye movements. No afferent pupillary defect means optic nerve is not involved. And no restriction of eye movements. On imaging, right eye was seen to be bulging. So proptosis will rule out preseptal. Because in preseptal, before the orbital septum, there cannot be proptosis, there cannot be decreased vision, there cannot be ophthalmoplegia. And cavernous sinus thrombosis is not the answer, because in cavernous sinus they should tell you some extra features like loss of cheek sensation or other eye involvement. So answer here is sinusitis with orbital cellulitis. Now this is Hertel's exophthalmometer. Useful in thyroid, yes. Lacrimal gland tumor, yes. That causes non-axial proptosis. Optic glioma, axial proptosis. Retinoblastoma can have proptosis, but usually most common presentation is leukocoria. That's why the least common, and the answer over here should be retinoblastoma. It's an eyeball tumor, intraocular tumor. Leukocoria, most common presentation, 60% cases, 20% strabismus. It can have painful proptosis, but that is rare. But other three are definitely causes of proptosis. So answer least common is over here. The dermoid is a choristoma, normal tissue in abnormal place, because it is a germ cell tumor. It is a childhood tumor, most common benign tumor in child. So ABC are correct. Excision is done, can be seen in limbus, can be seen in orbit, but not associated with Wallenberg. It can be associated with syndrome which is golden hour syndromes, which includes preauricular tags, which includes colobomas of the eyelid, dermoid, that is golden hour syndrome. Wallenberg is lateral medullary syndrome associated with Horner syndrome. So that's the 8 questions. I hope you have done well. Thanks for listening.